I'm Katie. I have a pancreatic primary neuroendocrine. It's a grade 3, stage 4. I've since had surgery to remove that and have been in a variety of different treatments, including CapTEM, so some systemic chemotherapy. I've had liver ablation and am currently in a clinical trial. I've been in this clinical trial since January of this year. It's December now, so I'm entering my 12th month. I wasn't actually looking for a trial, so contrary to how I think some people think about it, I was not having exhausted all other options, but I was looking at a decision treatment window. So I'd had treatments last year that had gone well, but I'd had recurrence of disease. And I think, like any other treatment junction, I was taking a survey of the options available to me, which included a lot of different things. My specific case is that I have a higher grade, but low disease burden. And that alone sort of narrows the field. For example, liver-directed therapy, not yet something I'm eligible for. So when I was looking at the options, some of the other kind of more standard of care systemic treatments do have a higher toxicity. They come with a higher, side effect and or long-term risk. And for me, one of the things that has been really important as I manage this disease is trying to be as aggressive as I can in treating it while also keeping options on the table for down the road and including just generally lower risk where I can. So prior to joining this clinical trial, I did not know anything about clinical trials. So my experience up until then was that I heard about it in the movies. It sounded like something that you do when you have no other options, or you're really on the cutting edge of science. And it turns out I am on the cutting edge of science, and that has informed a lot of things about my experience. I think one of the things I've learned is that while things have been studied, and that means it's not the same as a complete unknown, there is a reason it is in a trial, both the uncertainty of its efficacy against the disease, as well as potentially the side effects, the treatment schedules, etc. So, kind of wrapping my arms around the level of unknowns and being willing to step into that is something that but once you experience, it does change a little bit. Having said that, I've been fortunate that it has actually worked out, both from an outcomes perspective. So far, we are doing well. I'm excited about the progress it's had on keeping my tumor stable. And where there have been unknowns, I have been able to manage them. One of the benefits of being in a trial is that you have an incredible care team around you. So, for folks who are trying to think about whether a clinical trial is right for them, I mean, there's a lot of different things to consider off the top of my head. A few would be first, just lifestyle. I think that gets kind of like a broken record in cancer care, but you're not off the hook for thinking about it here too. I knew I was going into a year plus of having every 3 weeks to be in office, regular appointments, and more frequent scans, which can be anxiety inducing. I'm scanned every 2 months for this trial. I was willing to take that on to have access to this treatment. I'm fortunate to live close to my care facility. I don't have caregiving responsibilities for children, but everybody's situation is going to be different. The second is a little bit more esoteric, but it is that level of unknown. So, questions to ask would be, what do we think the success rate's going to be? What do we think the risks are going to be? I am going to say you'll want to ask questions either way. And I think that includes, what are the options going to be if and as I have unexpected side effects? What are you, doctors, most worried about? And then the other thing that I really recommend asking is, if this doesn't work for some reason, what is my next option? I went into my trial already planning my second and third options. I've been fortunate to not have to go to them yet, but it was really important to me in that first 6 months to not have to simultaneously learn how to navigate these systems and drugs and research something else. And so you don't want to plan for failure, but you do want to be realistic. So, words of advice or words of encouragement for someone newly diagnosed with neuroendocrine cancer. Encouragement. I heard this when I was first diagnosed, and it was from somebody much older. And he said, your job is to just stay alive until they invent more things to help you keep staying alive. And I thought, that's really bleak. But okay, I'll sign up for that. And now that I'm a few years in, just in a few years, he was completely right. I've been very fortunate that I have not been close to exhausting my available options in those few years. And even so, there are new things that have become available that are less toxic, that are more effective. And it really is a wonder seeing the advances that science is doing, not just in cancer in general, but I think neuroendocrine cancer gets some of these therapies a little later. And the second piece of advice, which I don't know how to say without sounding preachy, but I'm going to just say anyways, is when I was first diagnosed, I heard a lot that we're balancing quality of life with care. And at the time, I felt like that is a defeatist attitude. I want to be aggressive. I don't care what my side effects are from treatment. I'm going to cure this damn thing. That was maybe not the right mentality, not because I'm not being as aggressive as I can, but quality of life is a much more expansive than just physical side effects. And that is the part I didn't really understand as it was originally presented to me. Accepting that I have a managed disease and that this is a part of my life, and just really searching over time and continuing to iterate on what your version of just living your life and taking care of yourself, which includes your treatments, is so important. It's a critical piece. Otherwise, I think you live in this constant mental state of crisis or of defensive mode or of limiting what you can do until you're just past the next treatment. I've certainly internalized that and embraced that more in the past year. And the sooner people can lean into that mentality in this disease, the better.